Welcome back to Fleshing It Out Career Edition. We are talking to Angie Onyekanne, physical therapist. Did I say that right?
Yeah.
Good. Whew. All right, Angie, tell me, you are a physical therapist, so I would love to know how you got into that career and kind of what that entails being a physical therapist.
I got into physical therapy because I had the experience of helping my grandma with her exercises. When I was 10, she had a stroke. And at the time, I didn't understand what physical therapy was or that I would be a physical therapist until I was in undergrad at Virginia Tech. And I had to declare a major, and I knew I wanted to do something in the medical field. And I was led to thinking about physical therapy. I had remembered that experience with my grandma, and I just decided to go for it. I have always wanted to help people, especially seniors, and physical therapy has such an impact on someone's life and rehabbing them to physically be well and do whatever it is in life that they want to do. And just to have an impact on that really is very rewarding and self-fulfilling.
That's awesome. And what is a typical day like for a physical therapist? Because you are in a car now, if our eagle eye viewers can see, because you do at home appointments, right? So your days.
Yes. Well,
tell us about a typical day.
I work for myself. I'm actually an entrepreneur, which is not typically common. I mean, there are physical therapists who are in private practice, but it's not something that we are encouraged to or trained to be business minded in school. So most people will graduate and go to work for in different settings, whether it's a hospital, outpatient sports clinic, a nursing home, or do home health through a home health agency. With my business, I work for myself, and I'm just a mobile therapist seeing clients at their home. It's where I feel like I can service them best versus working out of a brick and mortar clinic.
Especially because of your target clients, which are the elderly. So it's easier in home. Yeah, that's great. So you can kind of see how, depending on what population you want to work with, kind of where you'll fit in.
Yeah, it's different areas of therapy depending on what your interests are and the kind of clientele that you have a passion for helping. And for me, it's seniors.
Yeah. What kind of education? You mentioned you were pursuing your bachelor's at Virginia Tech. So what kind of additional training is required for physical therapy as far as certifications, training, education?
So it's the 4-year bachelor's to do your prerequisites, and then it's a 3-year doctoral program in addition to the bachelor's. Most programs have already converted to the doctoral level, and they're a minimum of 3 years usually. So that's what the physical therapy, the education entails. If you are interested in being a physical therapy assistant, that is just a 2-year associate's degree that you can apply for and obtain out of high school. So it's less schooling, but obviously the practice patterns are different between a physical therapy assistant versus a physical therapist. The income is different, but obviously the educational price tag is different too.
Yeah, definitely. But it's nice that there's a couple different options. So if you want to go into that field, it's I love that there's multiple options. What about hours working? You know, you work for yourself, so I know it'll be a little different based on what environment you're in, but what can you expect as far as how many hours you're working and days and things like that?
Well, that's the good thing about being a physical therapist is that it's very flexible. Contrary to like other medical professions, especially like a dentist office or something, they usually will have a freestanding clinic that's open for a long time, and then they schedule appointments, and then that professional is there all day. But as a physical therapist, depending on the setting, most settings that I've ever worked in, what time you clock in to get to work or leave, it's really just depending on whatever it is you want, as long as you're showing up to get the work done. And then, I've worked in settings where I show up for a part of the day. I see a couple people for their appointment, for their sessions, especially if they don't have freestanding appointments. It's just me doing like rounds. So going from one client to the next, and then would have left to go to a doctor's appointment or do whatever I want to do personally for myself. And then we'll go back to work to finish up the rest of the load. You can also do weekend work. You can do evenings. A lot of physical therapy environments are flexible to do the work because you are coordinating whatever your schedule is with the clients, or You're showing up to get a list of people that have to be seen. And then whenever you knock them out, then you're done.
That's great. I love all the options. What are your favorite and least favorite parts of the job?
So, favorite absolutely is just having an impact on someone's life as far as helping them be mobile. I mean, I have rehab people that in their lifetime never thought they would walk again, never thought they would get out of that chair, the wheelchair, and was able to have a direct impact on their ability to stand and move their legs. And not for my, physical effort working with them, they would have been left to continue to be disabled. So I just appreciate, the reward of helping people to just get back on their feet, because without the ability to be mobile, I mean, we're all restricted into what things in life we want to do and enjoy. And the fact that I made a difference in someone being able to fulfill their life without continuing to be physically impacted really means a lot. The one thing I don't like about it is physical therapy on a political standpoint, and everything having to do with like money and how we are paid and billing and all that. It's definitely a career that has a ceiling effect. So, a lot of how we are compensated is based on insurance reimbursement, which insurance reimbursement is changing. It just continues to decline. It's not an industry that continues to go up. They don't look to try to give you more money. So based on what insurance reimbursement becomes determines what therapy businesses pay their therapists. So you can only reach a certain amount of income based on the fact that the clinic is only taking but so much profit based on what reimbursement they're getting from the insurance. But that's just one avenue of how we are compensated with insurance. A lot of the new wave of where physical therapy is going is that clients are paying cash outright for services. So there's a lot of potential there for growth and more income potential for the therapist if you're not dealing with insurance.
Yeah, that's always kind of in the medical field. That's always kind of a pain point. Is there anything else career related that you think would be valuable for high school students, or something that you would have wished you knew at their age, kind of knowing what you know now?
Well, because things have changed. So therapy, as I experienced it after I graduated and got my degree, is totally different than what it is now. It is a field that is always evolving. And my biggest advice, now that I work for myself and now that I have, planted roots into my own means of practice, I strongly encourage people that if this is a field that they want to pursue, that they have it in their mind that they're going to be their own private practitioner and represent a niche market of a clientele that they have a passion for helping. So if you're interested in sports and you were a swimmer or you play baseball, you would be great to help people rehab their shoulders. So that becomes like a niche market of an area that as a therapist, you can create your own business and be a guru around helping those people. Or you are a dancer and you want to help people, dancers with their feet and their hips, what they need to be good dancers. And you're taking your personal experience and relating to how you're helping the client. So then it makes you look like more of an expert or guru in that area, and you can build your own business around it. I mean, the sky is the limit upon acquiring the degree and then doing whatever in the education, doing whatever it is that you want to do with it. You don't have to necessarily come under someone else's business vision. You can create what you want for yourself. And that's not something that students are typically motivated to think about, but that's becoming my message for people who are considering the field and who want to go into it. The educational price tag has increased significantly. So something to consider is if you're not trying to think that you're going to be working for yourself, where you pretty much can set your own rates and all that, you're asking for a huge debt load that your employer what they're paying you. The debt to income ratio just doesn't make sense based on how much money you borrow to go to school, because the expense of the education has increased significantly and the entry level salary doesn't match up to being able to make those payments. So it's not like a doctor where, they make, there's certain specialties of medicine make a lot of money, but the price tag of what they pay for school, they can pay that. As a therapist, you'll be paying forever.
So you have a resource where people can, and this might be something that, guidance counselors and things like that, but to help figure out, to crunch those numbers, to figure out.
Well, you would look for what is the average average starting salary for PT in the area that you live. And then you would see what is the in-state tuition for the degree. And figure that if you had to borrow this money and this is all the money that you're going to potentially be making, then how are you going to pay for your other living expenses when you're going to have this debt bill from taking out a loan? And it's hard to work at the same time and fund a PT education while you're in school, because being in school alone is a professional program that is like a full-time job. Mm-hmm. So maybe, you know, if money is an issue, that you would take some time in between work and save some money to contribute, because this being a professional program, there usually are no scholarships or no fund assistance on part of the university to help you fund the degree. So, and definitely do not consider an out-of-state school for this professional program, because then the expense of the education would be even more. And it just doesn't make sense with what you're likely to be making as an entry-level practitioner coming out of school.
I appreciate you bringing up that point, because, you know, it's fun to think about, you know, all of the possibilities, but it's kind of like, what does it take to actually get there? So Angie, thank you so much. As we wrap up part 1, we're going to come back with part 2 with some bonus questions, but I appreciate you giving such good insight into the world of physical therapy, and also congratulations on starting your own business.
Thank you.
All right. Thank you so much. All right, we're back with round 2. We're here with Angie Onyekanne. She's a physical therapist, and we're going to do some quick bonus questions. Angie gave great insight on how the financial burden of physical therapy school can impact your future. So great insight. And so that kind of actually leads, it might answer this question, is what misconceptions do people have about your career?
From a professional standpoint, as far as the skill of what we do, I don't think the average consumer fully understands what physical therapy does, unless they have experienced physical therapy themselves. Usually they think of it as like a massage therapist or a personal trainer, but there's so much more to it than that. You really are helping someone rehab from an injury or a decline in status, trying to help them get back to a physical level, which they can be more independent. And unless someone has had that experience with a physical therapist themselves, I don't think the average consumer fully understands that there are so many ways in which we can help them, help people, help the community. But we as the practitioners should be doing better with how we market ourselves to spread the word to the community and how our services can help them, especially those of us that are specific to our niches and who we serve. And so I'm very specific. I'm primarily for geriatrics. So I try to, you know, put out a broader message for different ways in which I can help people.
That's great. What would people be surprised to learn about your field, you think?
Well, unless you work for yourself, you're not really in a position of being as autonomous when it comes to how you practice. And that could be that could put a damper on how you feel about doing therapy to begin with. I mean, you are the person who has the license and the education and should feel empowered that the decisions that you make on part of a client are your own. But when it comes to like certain political woes with employers and people you work for, it's not always that liberating. And that could put a damper on how people feel about practice at all. So that's part of what goes back to my encouragement for having people to just be their own solopreneurs and just represent themselves, because it can get kind of financially crazy, you know, from that perspective. I mean, which I know there are a lot of industries that it's all about money. And this is definitely one that it's just kind of, a lot of stuff just doesn't make sense sometimes. And when you want to be autonomous, like a physician who is representing their clients and they're making the decision. But if they work for a large hospital network, a lot of how they are doing business on the behalf of practicing is not so much of their decision alone. It becomes that corporation that's over top of them. And that's where I feel like it really can put a damper on your, you know, what you want to do for people and help them. And I feel like unless you work for yourself, you're not necessarily going to have that autonomy.
Yeah, that's a great point. It's we interviewed a lawyer for the career calls, and she brought up the same point about, you know, law is still a business, and it's like a common theme of all these interviews is that, you know, it is business. And so that's why I love these kind of behind the scenes talks, because it's not just, you know, if you love baking, it's not just about baking a cake. If you love helping people with physical therapy, it's not just about that. It's this whole behind the scenes part. So you mentioned the most rewarding part about being able to bring people back to mobility. I think that's really powerful. And the last thing is, what do you think are some gifts, talents, interests that are that people can have that are a good fit for the physical therapy world?
Just your desire to help people. I mean, this is a very intimate field with working with someone. I mean, you're giving someone more attention than who they ever get from any other medical professional that they would see. Mm-hmm. You know, you usually go to the dentist twice a year. You're in and out for a cleaning or procedure. No personal close connection to them at all in that way. Same thing with even seeing a doctor sometimes, unless you're going through a course of a treatment of some sort. It's definitely the one medical profession that you have to be a people person and know how to build a rapport with someone, because they're putting their trust in you to help them meet their physical goals so that they can live their life and be independent as much as they can. And if you are not that much of a people person, if you're not, you got to be a good communicator. You got to explain to people, like, you know, the different types of activities that you want them to do, recommendations that you're making for them to do their activities or whatever equipment you're recommending, and really walk them through a process where they feel vulnerable because they're physically disabled or physically hindered by, you know, doing something, or if they're, you know, in a lot of pain. Like, you just having that compassionate heart to help them. And, you know, it's definitely something that when people, I really like to live by the Maya Angelou quote about, you know, people don't remember what you say, they remember how you make them feel. And it's definitely an industry where how you make somebody feel is something that they'll always remember. And your compassion and care, being that closely working with them, is what you have to feel like you're up for with people, because people have different personalities and things. And it's not just a one stop, okay, you see someone one time and never again. You're literally building relationships and a rapport with someone, because if they get injured again, they need someone. They would think of you to come back because you helped them the first time. Definitely. So if you're not really much of a outgoing person or a good communicator, have a compassionate heart to help people, you know, especially when they're vulnerable and they're just going through a lot of issues, it's not the industry for you.
That's great though. But I love that you can put that stuff out there, because then, you know, people can use their gifts and talents. So, Angie, thank you so much for your insight, for your time. If someone wants to get in touch with you or your business, can you let us know where you're located and how to get in touch with you?
So I am always willing to chat with anyone that is interested in physical therapy. It is a career that is dear to my heart, despite all of its political woes at times. I feel like we need good people in this field to help people, especially with the elderly. I'm based out of the Cincinnati metro area, Cincinnati, Ohio, and my business is Seniority Wellness and Consulting, LLC. And my email is info@senioritywc.com, info@senioritywc.com.
Awesome. Angie, thank you so much. Appreciate your time. And thank you for all you do for your patients. And because I know you are amazing.
Thank you.
Bye-bye.